We're talking urological cancers. They include cancers of the bladder, the kidney, and other organs. But the big question is what types of treatments are available. So joining us to shine a little light on that and more, we have Dr. William Swanson. He's a urologist and a managing partner at Pioneer Valley Urology. It's a pleasure to have you here. Now, what I want to know is what types of cancers do urologists treat?
Well, thanks, Seth. It's a pleasure to be here. Urologists treat cancers of the urinary tract in men and women, predominantly prostate cancer, kidney cancer, and bladder cancer. We also treat cancers of the male reproductive tract. We see more rarely testicular cancer and penile cancer.
What are the treatments that are available and that you folks specialize in?
Well, urologists are primarily trained as surgeons, so our role in the beginning in many cancers is to remove the cancerous organ or the part of the organ that is cancerous. However, we really see ourselves as the quarterback in taking care of the urology cancer patient. So if a patient needs something like chemotherapy or radiation therapy or some form of non-invasive treatment, we will coordinate that with other disciplines such as the medical oncologist or the radiation oncologist to make sure that patient gets a seamless care for their overall cancer treatment.
So you do the surgery for the most part, but then going forward, if the patient needs radiology or some other treatments, you're at the helm and you're managing their needs along with other oncologists in different fields and buildings.
That's correct. So if a patient needs to see a radiation oncologist, for instance, we'll make sure they see that oncologist and then come back to talk with us to develop a definitive treatment plan for them to make sure everything's coordinated seamlessly.
And we could talk about cancer all day long, but a lot of the things that you see and that you treat when it comes to the prostate and those areas have nothing to do with cancer. Talk a little bit about issues that are faced in the prostate and how you treat them.
Well, one of the most common conditions we treat is benign prostatic hypertrophy or enlargement of the prostate, and it's really a very common problem for men. And what happens is men will show up with symptoms of urinary frequency, a weak urinary stream, getting up many times at night to urinate. And some men, unfortunately, end up to the point where they can't urinate at all, end up having to have a tube placed in their bladder to empty the urine, or call that a catheter. And you know, there is a way to prevent that in most cases, but the only way to do that would be to come to see your doctor and perhaps be referred to a urologist before things get too bad. And so when we see a patient like that, or any patient, one of the first things we do is a complete physical exam and history to get at the root of what kind of problem they have, and then we develop with them a treatment plan.
So if people are facing any of these issues, they can talk to their general physician or they can be referred to you. You do so many things at Pioneer Valley Urology, and thank you so much for stopping by today.
All right.
It's a pleasure chatting with you.
Thanks very much.
And if you want more information on Pioneer Valley Urology, you can call them 413-241-2100 or just visit them online, the website pvurology.org.